Hello everyone, this is Mina Petros. Today I'm talking about my presentation. I'm presenting my unique case, which is about the clavicle, fracture in the clavicle, and a patient has a surgery. So for the patient, the chief complaint, the reason for the examination, the status post-fall work injury, lost his balance, he started to fall forward, he puts out his arm to break his fall and came down hard on his left arm. He felt a sharp pain near his left shoulder and know immediately that he injured something. It was a fracture in his left clavicle. The date, and then he had a surgery. It was on December 5th, 2015. Today he comes in July 11, 2017. Still complaining. Patient is still complaining, complaining of the left shoulder. The significant medical history, as I said, like it was a trauma. He fall while he's doing the job. 2 years ago, he feel pain in the left area, difficulty moving the arm, swollen and tenderness along the clavicle, increased pain when trying to move the shoulder or the arm, and cracking sensation when trying to raise the arm. The level of pain from 1 to 10 was 9. Suspected fracture and had a surgery in December 5th, 2015. When he comes to our clinic, we position him for 2 procedures, which is AB and AB Axial. And I want to talk about a little bit about the clavicle and what is the clavicle. Clavicle is a bone that runs horizontally between the top of your breastbone, sternum, and shoulder blade, scapula, also called the collarbone. Helps connect to the arm to the body. You can feel it by touching the area between your neck and your shoulder. Most clavicle fracture happen when someone falls into the on the shoulder or outstretch your hand, putting enough pressure on the clavicle to make it fracture or snap. Most clavicle fracture heals on their own if the arm is probably immobilized in a sling and the injury is treated with ice or physical therapy. Sometimes, as in this case, as in my case, the clavicle injury may need surgery. Thus, the patient had the surgery here in the clavicle with the screws, as the patient get displaced and fracture or broke the particular severe. The severely displaced component, comminuted fracture, may require a surgery, as he get the surgery to realign the bone fragments and hold them in place while the bone heals. This is typically done by inserting special screws, as we see here, into the bone, or by the attaching metal plate to the outer surface of the bone clavicle. In general, the screws and the plates will not be removed once the bone has healed, unless they are causing irritation. After the surgery, doctors will often prescribe a therapy to help the patient regain movement and strengthen the shoulder. Typically, therapy will start with the gentle motion exercise, and strengthening the exercise will be added as the bone heals. For our procedures we done for him, we took in 2 images, and I positioned him for 2. The first geographic procedures, AB, and he was erect and centrally to mid the clavicle, SID 40 to 44. The collimation ensure that both the ESG joint, acromion, this acromion, this one acromion clavicle joint, and the sternum clavicular joint should be included. For the, as you see here, a little bit pictures for the shoulder. So here we done 2 procedures, radiographic procedures to the patient. I done it. I position him AB and AB XL. The first one for the first procedures AB. It was erect and the century coming to the mid clavicle. Mid clavicle, the SID was in 40 to 44. Collimation should be concluded the both joints, the AC joint and the sternoclavicular joint. It should be included, as here a little bit picture like I posted. As you can see, the whole acromion clavicular joint, this one acromion process and the coracoid process here, and sternoclavicular joint, and this is the clavicle. This is the body of the clavicle, and here you can see like two open collimation. I showed like a little bit collimation. That's a little mistake I did. For the second procedure, I did the AB XL clavicle. It was erect and century just angled to cephalate 15 to 30 to the same thing mid clavicle, and the marker, I forgot to put my marker, but the technologist brought the electronic marker. SID was 40 to 44. Collimation exactly the same should be, and here we can see the joints open. You can see the acromioclavicular joint, it's a little open here. This one, that's why like 15 to 30 cephalate. For radiologist report, status post to RIF of mid to distal clavicular joint fracture with the blade and the screw. The fracture appears healed. ORIF means open reduction and internal fixation. It's a type of a surgery used to stabilize and heal a broken bone. Open reduction, the orthopedic surgeons reposition your bone pieces surgically back into their proper alignment. Internal fixation refers to the method of the physically reconnecting the bone and use special screws, as we see here, the screws and the plates, or they using or nails to position the bone correctly. Also, their acromioclavicular joint, sternoclavicular joints appear unremarkable. Does mean not a particular interesting or surprising. Also, the radiologist report mentioned impression status post ORIF of methodistal clavicular fracture with the plate and the screws, and no changes from December 5th, 2015. What I learned from my case and my conclusion, in this unique case, I have learned to not rush to do the procedure and communicate with the patient physically and trying to touch him because he's in pain, and do not grab the arm and do it when you touching the patient carefully, gently. Don't try like communicate physically with him, although we have all patients history, so from now on communicate and will provide a good patient care. I forgot to put my marker, as I mentioned my mistakes. I forgot to put my marker, so the tech used the electronic marker. The second thing, my collimation was too open, and that's it. I hope delivered something to you guys, and enjoy it. Thank you.